The management of female infertility will depend on what are the outcome of the investigations. So when we run hormones and if we find something abnormal, say a hypothyroidism or hyperthyroidism needs correction before they venture into any form of treatment for pregnancy. Similarly, a hyperprolactinemia. So if prolactin levels are way too high, then it's important to control that before venturing into any form of treatment. Coming next to polycystic ovarian syndrome, wherein AMH or anti-Mullerian hormone tends to be very high. Now, those are indicators that the lady is not forming eggs at all. Now, it's important in such women that we prescribe medications to correct the ovulation. Now, before venturing into treatment, and if the couple is motivated enough and the lady is overweight or in the obese range, it's important to give some months time for appropriate management of lifestyle, get into a good weight management, a diet plan, exercise plan, aim for at least 5% weight loss, because even 5% of weight loss actually improves not only spontaneous egg development but also the response to treatment. A person who might be injection dependent may actually downgrade the treatment to just 2 tablets. So it's important that lifestyle advice is given to women with polycystic ovaries, especially if they're overweight or obese. Now, once that is ascertained and they have lost weight and ovulation still persists, it's important to start off ovulation induction medicines. Now, these are something that can be attempted in general for all women, even women who are regularly ovulating, just to enhance the chances of conception. Now, these are called as ovulation induction tablets. There are 2 or 3 kinds of them. The popular choices are clomiphene citrate and letrozole. These medicines help in making sure that the egg development is appropriate, and one may consider something called as follicular monitoring tracking, wherein a doctor gives these medicines and then tracks the development of egg and can advise the couple as to when the egg is releasing so that the couple can try naturally. Following this, if in case there is no response to the tablets, very rarely there might be requirement of injections called as gonadotropins. Gonadotropins are injections that helps in or rather stimulates the ovary to form eggs. These are nothing but hormones that the brain secretes naturally, but in polycystic ovarian syndrome there is a disturbance of secretion of these hormones. So this is given in the form of an injection which helps in stimulating the ovary to form an egg. So gonadotropin dependent ovulation cannot be done month on month for too long. So once a person is injection dependent, it's important that we do not keep trying injections for too long. Maybe in a cycle or 2, if they don't conceive, they could consider escalating the treatment to ART procedures like an IUI or an IVF, because injection dependency for ovulation should be taken seriously, and taking injections for prolonged periods can demotivate the lady. Having spoken about medications, there are few surgical interventions which might be recommended in women in whom an ultrasound has shown an abnormality. A surgical intervention would include either a hysteroscopy, wherein if there is a polyp needs to be removed, or if there is a septum that needs to be resected, or if there are adhesions inside the uterus either due to past infection or past BNC needs to be corrected. Or it could also include a laparoscopy, wherein you need to identify if there's problem with the tubes, you need to remove if there are any adhesions, if there are any fibroids that need to be removed, or endometriotic cyst that needs correction. So these are all conditions wherein a laparoscopy will help us. Coming lastly to ART procedures, that is assisted reproduction technology procedures, which would include smaller intervention, which is an intrauterine insemination, or a more invasive intervention, which is a in vitro fertilization and embryo transfer, or which is commonly called as test tube baby. IUI or intrauterine insemination is a simple procedure wherein ovulation is tracked and the husband's sperm is put inside the uterine cavity. Now, how does this help? Basically, by doing this, the number of gametes, that is the number of sperms inside the uterus, are immensely increased. Naturally, it's a few hundreds, whereas in an IUI, a few millions of sperms are put, and the distance between the egg and the sperm is also reduced. By doing this, the proximity of the gametes is more, so the chances double up. If naturally the probability of conception is somewhere between 8 to 10%, in an IUI it can be up to 20%. IUIs also are extremely beneficial with borderline male factor infertility, that is, if there is an abnormality in the semen parameters which are not very severe, one could try an IUI. Similarly, in donor insemination, wherein if the husband is not producing sperms at all, in such situation when they are adopting a sperm, an IUI is an important choice. Similarly, also in conditions of discordant infections, say if the husband is HIV positive or the wife is HIV positive, or for that matter any of the sexually transmitted infections, IUI can be an option to minimize the risk of transmission of the infection. IUI is also a preferred choice, especially in polycystic ovaries when multiple times of ovulation and time sexual intercourse hasn't worked. IUI becomes the next step of treatment. Unexplained infertility, where everything is normal and the couple hasn't conceived for at least 2 years, in such situation IUI also can be a treatment of choice. IUI can also be a treatment treatment of choice in women who have mild to moderate endometriosis, basically because in them the tubes are functional and also the tube-ovarian relationship is maintained. Especially post-surgery, when an endometriotic cyst is removed and tubes are working well, IUI can be offered as a first line of treatment. So the most efficient process among all ART procedures for reaching a pregnancy currently is in vitro fertilization and embryo transfer. Now, this is the treatment of choice in blocked fallopian tubes because there's a structural blockage wherein eggs are not reaching the uterus or the sperm is not reaching the egg. It's important to aspirate the egg, fertilize, make an embryo and transfer into the uterus. The next condition wherein IVF is very good choice is severe male factor infertility, especially in men who have obstructive azoospermia, wherein there is sperm production but it's not seen in the semen, wherein we have to remove sperms from the testis. In such situations, IVF is the mainstay of treatment. In severe oligoasthenoteratospermia, wherein the count is less than 5 million and a few motile sperms are there, in such situations also IVF becomes the mainstay of treatment. If suppose the lady is suffering from premature ovarian failure and there are no eggs at all, so in such condition, egg donation or ovum donation is the only way of reaching a pregnancy. There also IVF by default is a treatment of choice. Coming next to conditions wherein you want to prevent heritable diseases from going on to the children. So there are conditions wherein there are autosomal recessive disorders, autosomal dominant disorders, genetic disorders in the parents or parents are carrier of such disorders. So if we intend to try and avoid it getting onto the child, there is a procedure called as pre-implantation genetic testing for the abnormality, for the mutation. Now if we are aiming to do that, IVF by default we have to go ahead because in IVF we create embryos. Once the embryos are developed, we take a few cells from it, test as to whether the embryo is normal before transferring it back into the uterus. This helps preventing the transmission of the condition to the next generation. IVF also can be a choice of treatment in moderate to severe endometriosis, wherein endometriosis has affected the tubes and also caused a lot of adhesions inside, due to which natural pregnancy may not be possible.